Welcome, everybody. This is Dr. Archana Shrestha, and I am one of the co-founders of the Women in White Coats blog. I'm so very excited to be talking with one of our top 12 Women in White Coat heroes, Dr. Amanda Mohammed. Welcome.
Hi, thank you so much for having me today.
Well, you're welcome. And so we're going to be talking a little bit more about your background and all the great work that you're doing, and which has led you to be nominated as one of our heroes and selected as one of our top 12 heroes. So I'd like to read for everybody who's listening your bio. So Dr. Amanda Mohammed is originally from Garland, Texas. She completed her undergraduate degree at Southwestern University in Georgetown, Texas, receiving her Bachelor of Science in Biology and a minor in Spanish in 2008. She studied abroad in numerous countries such as Argentina, Mexico, El Salvador, and Guatemala. She has a strong passion for community, international medicine, public health, and HIV/AIDS advocacy. She graduated from Ross University School of Medicine in Dominica, West Indies in 2015. She completed her family medicine residency training in Dallas at UT Southwestern Medical Center and Parkland Hospital in 2018. She has an international medicine and public health diploma and serves on the Young Professionals Advisory Council for the HIV/AIDS Resource Center in Dallas. She is a board certified family medicine physician. So you have done so many great things, and sounds like you're quite the globetrotter. We are definitely going to talk about all the international work you are doing, but I wanted to kind of take it back. You know, what made you get interested in medicine? How did you decide that you wanted to become a physician?
Yes, yeah, for sure. Well, ever since I was really young, I've always been interested in medicine, but I would say kind of the catalyst to it all was my very own pediatrician when I was young. And I just loved just how personable she was. She made it a very comfortable environment. And you know how it is as a kid going to the doctor, you're terrified. And I was definitely one of those kids that everybody wanted to be on the lookout for. And I now like make a joke to my patients that now it's coming back to me, right? The screaming and just kind of being afraid. But she was just very, as I, got older, just getting to know her more and seeing her drive and her passion towards her patients was just really tangible. And I like, wow, like what a great profession. Like she really loves what she does. And I think as that sort of stimulated my interest into medicine when I started in high school and throughout college, just taking more courses more focused in, preventative care and just kind of learning about that. But I think one of the main drivers was when I was younger, I did a trip with my parents. It was a family vacation, but we did a lot of trips when I was younger that did have a purpose to them. My parents were always very intentional about, we're going to go on a trip and we're going to have a great time. And not a lot of people get a chance to do this, but also learning about the culture we were in. And it was a very significant moment because we ended up going to Jamaica. And at the time I was about 10 years old, and there was a young man that was walking on foot to a local hospital for medicine for his mother. And that really stuck with me. And I didn't really understand, here I am with this awesome pediatrician back home. And it seems like, I can get an appointment if I need to with her in case something were to happen to me, or my parents could go to a doctor of theirs. But why was it that he was walking by foot with barely, walkable shoes? And that stuck. And I started asking questions, which led to other questions. And then that became a really big opportunity for me to learn. And I started to really, just kind of jump on that journey. And I always had it in the back of my mind, how can I give back? I definitely still obviously feel that way. But, there are also a lot of opportunities domestically as well. But I think that just kind of helped shape, the ambitions that I had growing up. And I never really looked back kind of after that. And I had a lot of other opportunities thereafter to really cultivate that more.
Oh, wow. What a wonderful story. I mean, it kind of just takes home that point of like, as we are taking care of other people, especially little boys and girls, they could be really looking up to us and thinking, oh, I want to be a doctor just like her one day, you know, and it's such a
Yeah.
wonderful thing to think about that. And
Mm-hmm.
also, you know, that we are making these impressions on little children. And I also think that's
Yeah.
really cool how your parents, you know, it wasn't just all going to hang out on the beach, but you were going to learn
Mm-hmm.
something about the culture. And I love that your parents were intentional about that and learning about other
Yeah.
cultures. I too love to travel the world, and I like to expose my kids to other cultures too, now that I have children of my own. Um,
Yes.
and so, how did you end up deciding on family medicine? I know you were highly influenced by your pediatrician. Did you consider pediatrics, or was it just family medicine all the way?
Yeah, no, I definitely was one of those students that was very interested in both. And so it was very hard initially to make that decision and what was going to make that, I guess, final moment of choice, and especially in the match system, that I'm going to choose family versus pediatrics. But the great thing that I loved, and what decided kind of the deciding factor, was that I loved seeing the entire family and being able to really, hone in on that continuity and seeing, from birth essentially to the very, ends of life. Like, I think that that's just a beautiful thing. And plus, there's just so many other interests that I had that I felt like it may have been a little bit narrow too much if I just stuck possibly with pediatrics. But the great thing is that the role that I am in at this time, it's so bread and butter pediatrics as well as just everything with family medicine. So I kind of get the best of both worlds anyway, which is pretty great. But yeah, I love the fact that you can establish that relationship with an entire family. And especially even in the community that I'm in now, it's very full circle because, where I grew up is where I practice. And so being able to, randomly, sometimes as I'm shopping for groceries or going to the mall or something like that, where you run into people, I think that's a very neat thing that not a lot of people get a chance to have. And so I really, I'm very appreciative. I feel very fortunate to have that opportunity to be able to have that type of relationship with patients of trust, and, having other people that they bring on into the clinic just because of the relationships that they formed with me. And throughout medical school and even into residency, I started to notice that kind of, instinct kind of deep down in me that really wanted that. And I did some sub internships along the way in both pediatrics and family medicine. And when doing that, I was able to kind of hone in more on those attributes that I thought, okay, I can really see myself doing this more so long term.
Yeah, wow, how wonderful. Yeah, I agree. I mean, I think it takes you kind of have to have the right personality, I feel like, to go into family medicine. Like, you have to really enjoy like all the family members, right? And
Yeah.
I think it's kind of cool to also, my mom was a family medicine physician, and
Okay.
she kind of like grew older with her patients, you know. She was like, yeah,
Yeah.
like a lot of them remembered her when she was pregnant with us, like me and my brothers. And she kind of would go to all sorts of things, like all the family. I'm sure you get invited to like birthday parties or weddings and
Yeah.
family events. Like, they
Exactly.
consider you kind of part of the family.
Right, exactly. No, it's great. It's a huge honor too. It's like, when you think about that type of relationship with anyone, and they're inviting you in that capacity, even more so than what goes like into an office visit. It's so much more than that. So I do love that.
Yeah, and then especially you mentioned that you practice in the community where you grew up. Do you have any interesting stories related to that?
Yeah, yeah. I mean, not to like break confidentiality or anything, but yeah, there's been there's been a lot of like really full circle moments where, haven't seen people in years, and then all of a sudden it's like, wow, okay, here I am now. And, just with everything that I've done in the past with going to medical school abroad and having different locations that I've done various things in, and then coming back to Dallas and to my hometown and being able to kind of have that full circle effect, whether it's meeting certain people that I haven't, seen in ages, or working with people that I never thought that I would really have the opportunity to work with. It's pretty neat. So yeah, I definitely think having those connections and being able to really formulate deeper relationships. I wouldn't have necessarily thought that that would have been the case. I always wanted to come back to Dallas, but I didn't know if it was really going to be a possibility just because of everything that can sometimes happen with the match system. But yeah, it really worked out for the best. And it's been a really great transition over these last couple of years being out of residency too.
Yeah, I'm sure some of your patients have been like, well, look at you, you're all grown up and now you're my doctor. Or like, yeah, I actually practice in a community that is close to where I grew up, but not exactly the same community. But there are some doctors that practice at my hospital that I kind of knew growing up, who my mom worked with too. So it's kind of like an interesting.
Okay.
Yeah, and my mom and I practiced under the same name. Like I kept my maiden name for life, and so that's been kind of interesting.
Yeah.
But so anyway, let's get into the international work. I'd love to hear like what inspired you, what kind of international work have you done, and yeah.
Yeah. Well, definitely, as I was saying first, just kind of how even just growing up and doing a lot of different trips with my family, that definitely led me, to explore that a bit more. But it wasn't really until I would say in college, I was able to study abroad. And I did so first in Argentina and Buenos Aires specifically. And I got to live with a family there and really get assimilated into the culture that way, which was the best way possible. My Spanish was okay at that time. And I was thrown into a situation where it was like, okay, no one knows English. And, my host brother's like off to the side, like spitting 100 miles a minute. And I'm like, all right, I guess I'm learning a lot this summer. But I ended up working at a pediatric hospital actually there, and got to have a lot of different experiences with some local physicians in the city. I learned a lot about like Chagas disease at that particular time. I know that it was like really big there, an indigenous population that would come into the city for medical care. So learning kind of about those disparities was huge for me, like that summer. And and being able to have a lot of hands-on experiences with the local physicians. So that was really great. And I would say from that experience onward, I was able to, really sort of discuss a lot of different aspects of medical care with other providers where I was living. So I moved to California. I was living in Berkeley, and I was going to do a post-baccalaureate program there. And I was doing a lot of advocacy work at the time locally for the Save Darfur campaign. And I met some people through that. And one was a family physician at UCSF that became one of my biggest mentors. And she was doing a lot of work internationally in Nairobi. And so we were talking about that for some time. And, she was telling me just sort of the, overlay, between her work and family medicine and how she's able to do a lot giving back into the communities there in Nairobi. And so whenever I got into medical school, there was, obviously I was abroad in the Caribbean. So I did a lot of hands-on work there. And part of the beauty of being able to go to school abroad, and specifically when I was in Dominica, was that if we were learning that essentially if our campus was not there, a lot of the medical care services for the community would be non-existent. And so we had a huge privilege and an honor to, learn and also teach individuals, community health workers, be on the grounds. And also, you're learning from people around you too, to deliver the best we knew how, of course, with our, experts on the field, in the field with us. And so that helped a lot. And whenever we were kind of towards the end of medical school, there was a trip actually to Nairobi. And so that was a really nice kind of connector there from years previous when I was living in Berkeley. And so I, reached out again to my mentor and was asking kind of about the landscape of the area and different places that she had volunteered her services at. And we ended up going to a few areas in Nairobi that were in such desperate need. And the good thing at the time is that there was a lot of continuity with care. So a lot of medical students previous had gone to the same areas, delivered care. And so there was a system in place. And so I was able to help in a lot of different ways with arranging a lot of the triage and kind of getting people in the lines, like who is going to be first priority versus, maybe second tier, just depended. But it was my first huge experience with, how much the need is in certain areas for people to be walking like for miles, for days, just for, someone to do a basic physical exam. And a lot of them had never been seen by a physician before, or some of the kids had not obviously maybe had like vaccinations and certain things that we really kind of consider very bread and butter and just point of care. And for them, that's not the case. And so during that time, we were probably there for about days. And I think from what I recall, 1,000 or so people we delivered care for, which was amazing. Tons of different stories and different things that, I just would have never seen if I hadn't have had that experience. And a lot of very difficult cases, specifically even some deaths that unfortunately happened, but also success stories and, just huge, huge blessings of being able to be at the right place at the right time, have the resources available to be able to deliver care, and also being able to work without the essentials that we have here at home, and really trying to go back to those basic things that I did learn in Dominica and on the grounds, and taking that with me. I think that's probably one of the biggest aspects of international work that I've definitely tried my best to continue to emulate here in the States, is really trying to realize if we didn't have what we had, what would we do? And just, trying to have that thought process, because whenever I was able to kind of have those experiences in Kenya, more recently as a resident, I was able to help take a trip with medical students and physician assistants to Guatemala. And it was during that time that I was like, wow, I have seen myself even grow in that, my abilities, and being able to even teach other students and residents, okay, this is what you should be thinking. And this is how not to kind of get in a box, so to speak, so that you don't get streamlined just in one direction, but really think big picture. And so, yeah, that's really helped me, shaped me who, like how I've become, in my clinical practice, and how I still want to develop into even better, in terms of just my ability to connect with people and just, learning about their cultures and what they believe, because a lot of that also has to do with how medical care is delivered in other countries as well. So yeah, it's been fantastic. And I am a huge, huge advocate of, if people have the opportunity, and hopefully even different medical schools and residencies creating that opportunity for students to have that, I think is really essential. And it does help you in a lot of ways that you would never expect.
Yeah, absolutely. I think that's so wonderful that you had all those opportunities. I too have had the opportunity to work internationally, in like Ecuador and then in India. And I've seen some of the medical facilities in Nepal as well. But I think it really opens your eyes, to how the rest of the world oftentimes is managing without the same resources that we have. And it also makes
Yes.
you realize like, wow, how lucky are we to have all of this, and so much
Yeah.
regular healthcare, and access to so much. And then there's so many
Mm-hmm.
people in the rest of the world who don't have much at all. And it's very interesting
Right.
also just to see the systems and how things work. For me,
Mm-hmm.
I was interested in doing some international emergency medicine because I have a
Yeah.
emergency medicine background and specialty. And just, in other countries, there's no 911 equivalent or
Yeah.
EMS, like if your loved one is having a medical emergency, you're supposed to just drive them. That's probably the fastest way to get
Right.
them there. So, I mean, even
Yeah.
something like that, like, wow, like if that didn't exist in
Yeah.
this country, like, oh my gosh, like how big a difference would that be? Um,
Right.
yeah. So was there anything like you were just like shocked by when you were like working abroad? You're like, wow, this is just so different.
Yeah, I mean, I definitely think that in a lot of areas, just like the tier system, right? Of like even how people can be judged in certain areas where they live. Of course, we have certain discrepancies, obviously, here in the US, that's for sure. Nothing's perfect. But I think in the sense that I was shocked, I guess more recently with the trip, it was a particular person that we were delivering care for that had been really kind of banned from the area. And then when said person came to the area and we delivered care, it was almost like then we were associated with that person and maybe we weren't
Mm.
so good. And so it's like those types of situations that can happen. And at the end of the day, a person is a person. You do the best that you can and with the resources that you have available, and you treat them regardless. But I think that was a really good teaching moment, especially for a lot of people who had never been abroad before that also came on the trip, and sort of going through that, teaching through that, and what to do and next steps. But I think the presence that we had and the care that we provided really showed the community at large, maybe this wasn't like something that we should have blown out of proportion. And really, at the end of the day, it actually did change things, which was pretty remarkable. And so, from what I heard thereafter from locals on the ground, like that person was then accepted back in, and there was a lot of different changes that happened after the fact. So people always wonder, well, is it really going to make a difference, or certain actions that you take? But I really do believe in that. You never know what can happen by just staying true to what you're there for, and also just recognizing that you are coming into an environment that's not necessarily something that you're familiar with, and so being receptive to that and not taking offense. So I think in that kind of like cultural awareness and cultural competencies, like those things are very important also to be aware of, and also just kind of being open to learning along the way. So yeah.
Yeah, absolutely. And then do you also continue to do international medicine? I know, probably as family life has become more prominent, or I'm not sure if you have children, but, that was one thing for me. Like, I really wanted to do some international emergency medicine, but once I got married and had kids, I'm like, well, then there's the practical part of life. Like,
Yeah.
how much can I really be traveling away from my family and kids, while they're little?
No, for sure. No, that's true. Yeah, I actually just got married a few months ago, and definitely that is something that changes the dynamic of how often can you go, and like how much time do I spend away. And I'm super close with my family as well. So, but the great thing is that we do share an interest. He's not in medicine, but he's super compassionate and wants to give back. And I think that there's a lot of opportunities for that, and especially probably before we do have kids, to be able to do different trips together, and also so that we can, have that kind of experience. I think that would be great. There's so much that I tell him when I come back from a trip, and I think it would be great to experience that together. But the plan is hopefully to do a trip within this year, whether it's through the same organization, hopefully, if time permits, that I went to Guatemala with actually about a year or so ago. And that would be fantastic to kind of have again that continuity there. Or doing it through another organization, but I'm not sure exactly what that looks like. But the plan is hopefully to do something at least annually, and I would ideally like to do that with students too, because I thought that that experience was really great. It's so interesting, like when you are, throughout the phases that I was interested in international medicine when I was in undergrad, and then, well, even previous to that, just kind of traveling with my family, but in undergraduate and then in residency experiencing that. So I think it would be great to kind of see through the eyes of people that are interested in international work and being able to kind of coach them through that in a way. So yeah, hopefully this year. So
yeah, and then maybe things will come full circle one day when you have your own kids, if and when you do. I don't know if you want to, but and you'll take them on international trips, like, missions, and to do work internationally, and they can see too
yes.
what all you do.
Oh yeah, I would love that. That would be definitely goals for sure.
Well, thank you so much, Amanda, for talking. This was wonderful. And congratulations again on being one of our top 12 Women in White Coat heroes.
Thank you. Thank you so much. And thanks for your time too. I appreciate it.
Yeah, so this was a wonderful conversation. And for everybody who's listening, please head on over to our website, womenandwhitecoats.com/heroes to vote for the Hero of the Year. And also check out all the great events that we have. You can join us at the Heroes Ceremony, which is going to be May 1st, 2020. Or you can also join us at our Women in White Coats Conference and Wellness Retreat, which is April 30th through May 2nd of this year, 2020. So head on over to womenandwhitecoats.com to check it all out. And well, thanks again, Amanda. We'll talk to you soon.
Sounds great. Thank you so much.